righty. Good morning, everyone, and welcome to the seventh webinar on our volunteer update webinar series for the Tennessee SHIP and SMP program. This month we are going to focus on the Part B Equitable Relief program that's been started for people who have enrolled into the ACA marketplace when they really should have enrolled into their Medicare. And we will also be talking about what we know about the TennCare Renewal Process. And for those of you who don't know me or haven't seen me in person, I kind of stole what Lonnie Hitchcock is her last name, Hitchcock did last month and gave you all a picture. I hate taking pictures by myself, so that is me and my beautiful niece Paige, who looks like my daughter, but she is not my daughter. She is my oldest niece. So got to have the cute stuff happening first. So first thing we're going to talk about is the equitable relief. Oops, maybe. There we go. But before we talk about the equitable relief, I'm not sure if all of you are aware of how Medicare and the marketplace actually work together, or actually they don't work together at all. So we're going to do a brief overview of Medicare and the marketplace. They are two completely separate entities. Medicare is on one side, marketplace is on the other. They do not work together. If you have premium-free Medicare Part A, meaning you've worked those 40 quarters and paid into the FICA tax and you don't have a premium for your Part A, you are considered covered through insurance and you do not qualify for the marketplace benefits. And when I say marketplace benefits, I mean the tax credits or the cost-sharing benefits that go along with the marketplace if you fall into certain income categories. And it doesn't matter how you're getting your Medicare. You can get it through original Medicare or the Advantage plan. You still do not qualify for the marketplace and you don't get those credits or cost-sharing reductions. And many of us may not realize this, but it is illegal for an agent to sell a marketplace plan to someone who they know is on Medicare. And the only way that we're seeing that some people keep their marketplace plans and opt out of Medicare is because they've had that marketplace plan, or also called qualified health plans, or QHPs, before they became eligible for Medicare. So we're seeing this a lot with our beneficiaries who are under 65, and they're in that 24-month window of getting Social Security disability and then having to wait 2 years before they become eligible for Medicare. So we're seeing that a lot right now as well. So how do they coordinate? Like I said, they don't. With the small exception of if you have employer coverage and your employer is getting your health care coverage through the marketplace, through the Small Business Health Option Program, or the SHOP program, then you actually have the marketplace plan, but it's considered employer coverage, and it works just like the employer coverage rules in coordination of benefits. Your qualified health plans are not secondary to Medicare. So if you have a beneficiary who is on Medicare and on a marketplace plan, the marketplace plan does not cover what Medicare doesn't pay, or vice versa, that I don't remember what I said at the beginning. Oh, no. The marketplace plan won't cover secondary to Medicare, and Medicare doesn't cover secondary to the marketplace qualified health plan. It used to be that if you enrolled into or kept your qualified health plan through the marketplace and you did not enroll into Medicare Part B, you would be assessed a penalty for life. Well, today we're going to talk about the limited-time equitable relief that would actually eliminate that penalty if you have a beneficiary who kept their marketplace plan. So we're going to talk about that here in a minute. The only way that you can have a marketplace plan, even if you're eligible for Medicare, is if you have to pay a premium for your Medicare Part A. So if you have less than 40 quarters of work history and have not paid into the FICA tax, you could be eligible for the marketplace plan rather than paying the high premium for your Medicare Part A hospital insurance. So that's an overview of Medicare and the marketplace. Does anyone have any questions on that before we talk about what equitable relief is? I'm trying to see. I don't know if I can see if people are raising their hand or not. Let's see. All right. Doesn't look like anybody has any questions. So we're going to continue on. So what is equitable relief? And I know you all can read, but I am going to read this to you to make sure we have the actual definition. And this is a definition from the Medicare Rights Center, who I got a lot of my information about. This particular policy came from the Medicare Rights Center. So equitable relief is an administrative process created under federal law. That's very important. It's under federal law that allows people with Medicare to request relief from the Social Security Administration in the form of immediate or retroactive enrollment to Medicare Part B and or the elimination of your Part B premium penalty. So that is the definition of equitable relief. Now, we also do have equitable relief for prescription drugs or your Part D or even Medicare Advantage Plan Part C. Now, the reason it's not included in this definition is because Part D and Part C, or Medicare Advantage plans, don't go through Social Security Administration. They go through equitable relief through the Centers for Medicare and Medicaid Services. So we're not going to talk about that today, but I do want to let you know that if something happens with a drug plan or a Medicare Advantage plan, equitable relief still may be an option or an avenue that you can take. So what is this limited time equitable relief for Part B eligibility? So what it means is this is only for people who are eligible and have paid, or excuse me, they're eligible for Medicare, meaning they have premium-free Part A, and they also decided to keep their Medicare, or their ACA Marketplace plan. So that means they had an initial enrollment period for Medicare that began April 1st, 2013 or later, or they were notified of retroactive premium-free Part A on October 1st, 2013 or later. So either of those two scenarios, that beneficiary is going to be eligible for this limited time equitable relief. What are the benefits? The benefit is letting the beneficiary enroll in Medicare Part B without a penalty. So I have a client currently who was eligible for Medicare back in 2015, but decided to keep his Marketplace plan. And I told him, during the initial enrollment period or general enrollment period, you need to enroll into Medicare Part B, and he never did it. So he still has a penalty from 2015 that's growing. So we all know what the Medicare Part B penalty is, right? Somebody tell me what the Medicare Part B penalty is. Got to unmute yourself too.
Isn't it 10% for every year after you were eligible? But 10%
yes.
of the current premium?
Absolutely. Excellent. Thank you. So it is 10% for every 12-month period you were eligible but did not enroll. And it is, as Doug, I believe that was Doug, said, that it is based on the current year's premium. So this year's premium is $134. So whatever percentage of penalty is going to be based off that $134. And the beneficiary keeps that penalty for the rest of their life if they are 65 or older when they get the penalty. It also eliminates the beneficiary's Part B late enrollment penalty if they've already enrolled in Part B, but they got the penalty due to delayed enrollment because they had a qualified health plan. So if you have beneficiaries who you've helped get off of their Marketplace plan and get on Medicare Part B and they know they have a penalty and they've been paying that penalty, they can call Social Security and apply for this equitable relief and get that penalty eliminated off of their premium. So these are two extremely great benefits for our clients who are in these situations. Proof is needed, though, and a lot of proof is going to be needed. So I'm not going to read all of that to you, but especially for the qualified health plans, they need, a letter from the plan saying that they've been enrolled, premium bills or proof of payment, their IRS form that they show to their tax preparation people that shows that they had insurance for that year. Anything like that is proof that you were enrolled into the qualified health plan. Questions on that? The deadline for this is coming up quickly. So beneficiaries only have until September 30th of 2017. So they have a little over a month left to use this benefit. If they wait until October 1st, they will not be able to use it. Now, we have a situation that I'm working with one of our coordinators right now that they called Social Security, and Social Security said, I have no idea what you're talking about, and they don't qualify for any equitable relief, which is a very scary thing to hear. And I'm working with our Social Security contacts to get that rectified and get the information to the beneficiary and to Social Security. So I'm going to exit out of the presentation for just a second and show you what I sent you in the attachments of this webinar. So where did I get my information from? I got a lot of it from this flyer here from the Medicare Rights Center and the National Council on Aging, two very close partners with Tennessee SHIP and all the SHIPs across the country. So you can see here's the chart that I copied and pasted. So some perjury went on, but I did reference them, so technically it's not perjury. Some of the background and your steps. Another one that I did not send you that I'm going to resend out all the materials to everybody is something that the Centers for Medicare and Medicaid Services, or CMS, posted. And Alice, I'm going to get to your question here in 1 second once I show this document. So it has a lot of questions as to why they're offering this. So some of the things that you might be thinking of could be answered in this document. But I wanted to specifically point out, where is that? There was one about what should you do if Social Security questions you on this. Oh, there was another one that you're getting equitable relief from your Medicare Part B, but do you get a special enrollment period to enroll into a drug plan or a Medicare Advantage plan? And you do. That has to be requested through Centers for Medicare and Medicaid Services, if I'm not mistaken, but I'm not going to read all that to you. But it is possible that you can also get some of that equitable relief and not have that Part D penalty as well as your Part B penalty. How can I help? Maybe this is the wrong one. Yeah, this isn't the right one. But we do have some Social Security offices across the state, across the country really, because I was just at a national conference last week where this is a trend across many, many states, that Social Security doesn't know about this, or some of the customer service representatives that answer the phones on the front lines aren't aware of this rule and are telling our beneficiaries, no, this isn't an option. So I don't have it on my attachments, and I meant to put it on, and I apologize. But there is a letter sample that the Medicare Rights Center has put together that the beneficiary can send a letter in and also give some talking points with the actual citation of the policy as to why they qualify. So I will be sure to send that out to everyone as well. And I'm going to turn it over to Alice because I believe you had a question. Alice, you raised your hand.
Yeah, I do. So the deadline, is this like a one-time opportunity? Because there's still people who, I mean, whether it matters or not, but there's still people, like I did a presentation last week, I think it was. The lady is on ACA. She turned 65 in February, and she was wanting to know, why do I have to change? So what about the people that may qualify for Medicare after September or very close to the deadline and, do what a lot of other folks did, so I'm going to keep my ACA? Will they not have an opportunity, or is this a once a year? Do you understand what I'm saying?
Right, I do understand what you're saying, and as far as we know and what we've been told, this is going to be a one-time thing. So it's very important that we go out when we do presentations or have booths or do any kind of outreach for SHIP, that we let people know who are on the Affordable Care Act, if it's past this September 30th date or they aren't going to qualify for Medicare for a couple years, that when they do qualify for Medicare, they need to drop that qualified health plan, or else they will have a Part B penalty and it will stay with them. They won't get this equitable relief after September 30th, from what we've been told through the Fed.
All righty. Thanks. Thank you.
Good question. Good question. Any other questions? Because we're going to move into the TennCare Renewal Packet Process after this. So any other questions?
I have a question. This is Lori over at GNRC. Will they send out, like, notifications to the people that are on Marketplace that are about to go to Medicare that they need to change their plans and that they can't?
Sorry, go ahead.
That was it.
Sorry, Lori, go ahead.
No, I was done. That was just my question.
So it's my understanding that the Marketplace plans, once they're notified that one of their enrollees qualifies for Medicare, they have to send them notice that their health plan, qualified health plan, will no longer pay for the tax premium credits or the cost sharing anymore. So I don't think that they're notified that you need to drop our plan necessarily and go with Medicare, but they do say you no longer qualify for the tax credits or the cost sharing.
So
that can be very confusing.
Yeah. Yes, it can.
I was just sitting there, just a piggyback off of that, and it may not matter because maybe mine happened last year, but when I went from ACA to Medicare, they didn't send me anything. When I called them, they were clueless. They were like, no, you can stay. I said, no, trust me, I can't. So hopefully that has improved in a year.
Yes, hopefully. It's my understanding that that's the process that they should be following.
Gotcha.
Did I have another question? Or maybe it was more of a comment. All right. Anybody else have questions before we move on? We'll have time at the end, of course, for questions on everything, but while we're on the topic, I kind of want to see if anyone has any questions. All righty. So moving on. TennCare Renewal Packet Process. You may also hear this called redetermination. Those are interchangeable, means the exact same thing. They're renewing the benefits, and they're also determining if everyone on TennCare still qualifies for the benefits that they're currently getting. So let me give you a little brief history of the new Medicare Savings Program process. So many of you were around prior to 2014, but for those of you who weren't, prior to January 1st, 2014, the Department of Human Services handled the Medicare Savings Program application. And when I say Medicare Savings Program, I'm talking about QMB, SLMB, and QI1. So those are the programs underneath the big Medicare Savings Program umbrella, QMB, SLMB, and QI1. Due to the Affordable Care Act, the TennCare decided to take over that application process, and that began January 1st, 2014. So that's when kind of our dynamic shifted from Department of Human Services handling the applications to TennCare now handling the applications. So again, prior to 2014, Department of Human Services would renew recipients of their benefits on an annual basis. So they would see what day they qualified for benefits and let them know, typically over the phone. They would call and schedule phone interviews or even send mailings, or possibly, if needed, the beneficiary could go to the office to set up an appointment upon request. Documentation was requested to verify income and resources, just like the TennCare Renewal Packet process is doing right now. So documentation has always been a key to this renewal process. When TennCare took over, the renewing of benefits was postponed for quite a while. So typically, or generally, between January 1st, 2014 to around mid-2016, there was no process for renewing benefits, mainly because they did not have a computer system to redetermine eligibility. So that's why everyone who was on a Medicare Savings Program between 2015 and roughly 2016 kept their benefits no matter their changes. So I always do the dramatic example, and I do not have a client that has had this, but I just do this as an example that God bless you for that person who's sneezing and coughing. So the example that I give is if a beneficiary wins the lottery, for example, and they have a couple $1 million in the bank, they report that to TennCare because you have to report any income and resource changes. But if that happened between January 1st, 2014 to around mid-2016, their benefits would not be canceled because there was no redetermination process. Now, they're starting one, and it's been started and going on for probably close to a year, and they're getting these big packets in the mail. Oh, and we have a video. So I don't know how to get rid of that video, so we're going to put it down there. Okay. So the renewal packets are being sent to everyone on TennCare, not just people who are on a Medicare Savings Program. So if someone is on Medicare due to being a child, or a woman who has breast or cervical cancer, or any of the categories of TennCare, they are also being renewed and getting these packets in the mail. There was a recent article that I was sent last week, and if you're interested in the article, I can send it out to you all as well. But a TennCare representative did say that approximately 55,000 redetermination packets were sent specifically to Medicare Savings Program recipients. So that's how many are out there. The packet is very intimidating. It is 98 pages in length, including the letter that states certain things, that it's time to renew your packet, things like that. A good thing to tell our beneficiaries is only half of that is in English and the other half is in Spanish. So pages 1 through 47 are in English, 48 through 98 are in Spanish. You do not have to fill out both versions. If you speak English, only fill out the English portion. If you speak Spanish, only complete the Spanish portion. If you need the packet in another language besides English or Spanish, they can call and request a different language for the application. Of pages 1 through 47 that are in English, the beneficiary may only have to fill out pages 5 through 21. And the reason I say may is because not all pages apply to every single applicant. Like, for example, I sent you in the attachments a copy of the renewal packet, all 98 pages. So if you printed it out, hopefully you read my little disclaimer that it's a very large document, and if you wanted it, you only printed out the language that you needed. But there are some pages that don't apply to all of our beneficiaries. Like one is specifically for Alaskan Native. So if you're not an Alaskan Native, you don't have to fill out that form. And there's also some for additional family members. So if you are in a single-person household, you don't have to fill out the pages for additional family members because you don't have anyone that's living in the household with you. So it may not be all 5 through 21 pages that you have to fill out. And pages 22 through 47, those are all instructions. So it goes through every question, and if you don't really understand how to answer the question, you can look through those instruction pages and see how they want you to answer those. But again, 47 pages that I am given by TennCare can be intimidating to a lot of our beneficiaries, especially to those who may not be able to read very well or may not be able to read at all. So that is how the structure of the renewal packets go. Returning the packets. So in everyone's packet is a letter. And on that letter, it says the day that the renewal packet is due for that person. It is very important, and I didn't put this in my slides because I just thought about it. It is very important that the person who receives the packet fills it out if it's addressed to them only. Because what happens is there's a barcode on the application that specifically triggers TennCare to know that this packet is for this person. So it has to be the packet that TennCare sends them with their barcode to submit. Just like a regular application, we always want to encourage our beneficiaries to fax their packet and their supporting documents. That's the only way, unless you do certified mail, which some of our beneficiaries would not be able to afford because that is pretty expensive. That's the only way that we'll be able to provide proof that the Tennessee Health Connection has received that renewal packet. And I have the fax number down there at the bottom. It is not the same fax number that you fax your MSP applications to. If you fax a renewal packet to the MSP application number, that's not a good thing. I don't know. We don't know if it's actually going to get to the right people. So make sure you're faxing it to that 877-430-0843 number. That's the number you need to fax it to. How do we know that it was received? Well, the clients can call the TennCare Renewal Packet number that you can see on the screen there. They're getting a large influx of calls, as you would imagine. So if you don't want the clients to call the renewal packet number, the SHIP staff can look up clients, or most of the SHIP staff can look up clients to see if their packet's been received and what date it was received. And I'm going to show you a print screen here in a minute of exactly what we see in our system. Also, if the client faxed in their application yesterday, don't expect that TennCare is going to have that automatically in the system today. I would give them at least a week to 10 days before you submit a request to see if they've received the application or not. They're getting many a day. Like we said, 55,000 just Medicare Savings Program beneficiaries have received those packets. So they are getting a large influx, and it's going to take them a minute to get that logged into the system. So try to have that week to 10 days before a request to see if the application's been received or not. TennCare has 35 days, and these are not 35 calendar days. These are 35 business days once the packet has been received, to process the packet. Now, if the packet is in need of additional documentation, so let's say I send in my packet, but I don't send in my bank statement, because that's a big thing that all these packets need are the bank statements. And TennCare sends me a letter that says, hey, within the next 10 days, I need you to send in 2 months' worth of your bank statement. Once they receive your bank statement, they have an additional 35 days to process, because it kind of starts the process almost over from the beginning. So now they have the full packet, and they have that 35 days to process it. So it's very important that when we're working with beneficiaries on getting these packets in, that we have all the documentation ready to go for the first time that we fax it, or else it could prolong the process. Again, 35 business days, which means about 7 weeks, roughly, depending on when you submit that application and that packet. Any questions so far before I get to, and I'm going to talk about late packets, and I'm going to talk about things like that, but any questions on the processing as of right now?
I think I've got a question. I think this is a good place. If not, I can ask it later.
Okay.
We did a call yesterday with a client. We just walked through because she had been given quite a few numbers, and they were giving her some of the same. So the reasoning for calling the 844 number, would the primary reason for that just to be sure if they got the packet?
Yes. There's 2 primary reasons for the TennCare Renewal Packet number. The first one is you can call it to see if the packet was received, so they can tell you the date it was received, and you can start kind of looking at that 35-day window. Another one is if you didn't receive the packet or you threw the packet away, then that's the number to call to get a new packet. And we're going to talk about that in a minute as well.
Okay.
So that's a good question. Good
Okay,
segue. Good segue. Any other questions?
Yes, this is Barbara. I have.
Yes.
Can you look on the TennCare website and tell whether or not the person was sent a packet and when the packet was sent?
We are not able to look in the TennCare system. I only have about 10% access to the TennCare system, and we are not able to see if someone was issued a packet. However, that's a good segue into the next slide. We can see when the application or the packet was received. So we're able to look into a system. Oops, sorry, did you have another comment?
Well, the point is everyone was supposed, they set out 1.2 million packets. Are there more than 1.2 million people on TennCare in Tennessee?
No, that's the estimate of how many people are on TennCare in Tennessee, but they're phasing it out. So not all 1.2 million have received the packet yet. Of the 1.2 million, I believe the last estimate I saw was somewhere around 400,000 people who are on TennCare get a Medicare Savings Program. So only 55,000 have been sent out, estimated right now. So they're phasing it out slowly. Not everyone has received their packet yet. And we don't know what the process is for sending them out or who's getting them when, and we don't have access to the system to find that out.
Thank you.
That's another thing that you can call the renewal packet number and say, hey, has my packet been sent yet? And they may be able to tell you. I'm not sure if they'll be able to tell you that or not.
And that number, 844. Okay.
Yeah, that number is the 844-337-3348. That's the TennCare Renewal Packet number.
And they can call themselves to see if their packet has been sent. Or
yes.
to request a renewal.
Or to request a new packet. Most likely, as a SHIP staff or volunteer, if you call on behalf of a client to request a new packet, I've heard from some of the staff members that that's not an option. Some may have had better luck, but a majority of our staff has tried to call, and TennCare needs the client themselves to call and request a new packet.
Sydney, just to segue off of that question right quick. So as far as we know, the ultimate goal is to send this packet out to everyone that's on QMB just over a period of time?
Yes, we don't know the time frame, but it's not just for QMB. It's for SLMB, it's for QI1,
right.
It's for all the categories of TennCare. So I'm not sure. Right. I'm not sure the timeline of when they want all 1.2 million to have been determined or be sent a packet to possibly be redetermined. I just know that it's an ongoing process as of right now.
So if I'm presenting, I can say if you haven't got it, you possibly will get it, and this is what you need to do?
That's one way to put it. But we're going to talk in a little bit about why some people aren't receiving it who have actually been sent it. So keep that question for a little bit. And I believe Emma has her hand up for a question.
Sydney, I've had no trouble calling them and getting them to send out renewal package as long as the person is sitting there with me. They will go ahead and I can give them all the information. They don't even have to talk to them as long as they know they're sitting there. And like if I ask them a question, they will send it out. And also, some of them is just throwing them away and they don't know what it is.
Right. Yeah, we're going to talk about that as well. So definitely keep that thought in the back of your mind, Emma. But I do love that you have those clients with you and you help them make sure that they're requesting those packets. That's excellent. Thank you very much for that.
You're welcome.
And I know that's not an option for everybody because a lot of people do phone calls to their beneficiaries. And personally, I have no idea how to put a three-way call together. So it's always good if you tell the beneficiary, make sure you call the renewal packet number. that maybe in a day or two you follow up with that beneficiary to make sure that they actually called and got that renewal packet request in to TennCare. Excellent, excellent. All righty, so what can our staff see? And some of our staff have access to the system, some do not. But if the staff doesn't have access to this particular system, they can send a referral to me, and I can look them up and look up the client and see what's going on. So we have access to a system called Tennessee Anytime, and it tells us kind of everything about the benefits that the beneficiary is receiving. So we'll be able to see, based on their current redetermination status, that if it was received and what date it was received. Now, it's very important to note that if the beneficiary gets their packet in on or before that deadline that's on the letter, their benefits will not be canceled, and they will continue to have their benefits throughout the renewal packet process. The only way those beneficiaries will lose their benefits is if it's been determined that they no longer qualify due to an increase in income or resources. So just because they get the packet, as long as they get it in on time by that deadline, their benefits will not be canceled. Does that make sense? Okay. No news is good news. All right. Now, here's the big issue that we've seen across the state, is our beneficiaries are turning their packets in late. So if the beneficiary misses their deadline, their benefits will be terminated. So if my packet was due on June 20th and I send it in today, my benefits are canceled. The premiums will be deducted from their Social Security check. And typically there is a delay with Social Security being notified that their benefits have been canceled. So we've had reports of a lot of our beneficiaries having multiple months deducted from their Social Security check because their benefits were canceled, say, 2 or 3 months ago. Most of the requests that I've seen for beneficiaries whose benefits have been canceled is around 3 months of their premiums are about to be deducted. The beneficiary does have 90 days, these are calendar days, 90 calendar days from the day their benefit was terminated to submit their packet in order to have their benefits retroactivated to their termination date. So there's still possible that they can get those premiums back. And the easiest way to make this somewhat understandable is to show you what we see in the system so you can see how it works. So you can see this beneficiary has SLMB from January 1st, 2017, but it ends April 17th, 2017. That was their due date. I'm not
seeing that.
It should be on the screen. Is everybody seeing that on the screen?
Mm-mm. It still says late packet.
Uh-oh, still says late packet.
Oh, we're not seeing it.
There,
Uh-oh,
got it.
Is it on now?
It's there now. Thanks.
Okay, perfect. Whew, delay in the system. I'm telling you, technology, not always my friend. Okay, so this beneficiary, their benefits ended April 17th, 2017. Notice their redetermination status, their packet wasn't received until June 29th. So their benefits were canceled April 17th, but the beneficiary got their packet in within that 90 days of termination. So from June 29th, 2017, TennCare has that 35 days to process the packet, and if the beneficiary is determined to still qualify for the benefit, their benefits will be retroactive to April 17th, 2017, and they have the chance to get those premiums that were deducted refunded. Does that make sense? There's no way to expedite this process either. We can't do special circumstances for someone because maybe their check got cut in half. So it is very important that when they get that packet that they send that in right away. And again, we're going to talk in a little bit about some of the common trends that we're seeing. But for this particular beneficiary, his or her benefits are terminated as of April, and they still have 3 to 4 weeks before TennCare tells them if they still qualify for the program or not to get those premiums back. And even though they have the packet, the premium is still going to be deducted until that determination is made. Questions on that? Okay. We do have some clients who decide, I don't want to fill out that redetermination packet or that renewal packet. I'm just going to fill out a brand new Medicare Savings Program application to get my benefits back because they've been terminated. Not a good idea. Please, please discourage your beneficiaries from doing that. We recently had a case where a client decided, well, my QMB ended, and you can see everyone's seen this one that has the MSP application instead of renewal packet slide?
Yeah.
Okay, good. So this beneficiary had QMB until March 31st, and then it ended. So you can see his QMB, his or her, I should say, QMB got effective back on May 1st. So there was a month gap in April. What we found out was this beneficiary, instead of filling out that packet, because his deadline had passed, that's why his benefits were canceled, his deadline had passed, decided I'm going to fill out a new Medicare Savings Program application and send it in. Well, what that did was cancel his opportunity to get those benefits retroactive to March 31st when his benefits were canceled because he didn't turn in the renewal packet. And it's been past that 90 days now for him to return that renewal packet, so he doesn't have the opportunity to get that premium back for April. And notice up here with our renewal or redetermination status, there's no application that's been received still. So he does not qualify to get that April premium back because he filled out the new application. Does that make sense?
Yes.
Okay, we had a lot of questions saying, well, why don't we just do the renewal packet looks very similar to the Medicare Savings Program application. Let's just do the Medicare Savings Program application. Please, please, please do not do that unless they are past that 90 days of termination and they've contacted the TennCare renewal number and the TennCare renewal number has said your benefits have been terminated, it's been past that 90-day period, you are not eligible to get retroactive coverage, you need to fill out a new Medicare Savings Program application. Because there are some clients who request a new packet the day before their 90 days is up. Well, TennCare is not going to be able to send them that packet in a day. So if you call that TennCare renewal line, you may be able to get an extension on that deadline since the new packet's being sent. Emma, I believe you had another question.
They will sometimes give you the option that where they'll ask you, do you want to fill it out or do you want to do a new one? Because I didn't know which one to do, and I asked them which would be best, and they said, well, whatever you want to do. But I did just fill out for a renewal instead of doing a new one.
Yes, definitely renewal is the number one option. And it has to be the barcode. That's why we say, or we're going to talk about if you lost the packet or never received it, you have to request that new packet because it has your information on it or the beneficiary's information on it so it can be processed. We can't make copies or anything like that. So always, always do the renewal packet rather than a new Medicare Savings Program application. Any other questions or comments before we start talking about the common trends and complaints that we're getting from our clients? All right. So here are some of the common complaints that we get. My client did not receive the packet or was never sent the packet. So after some investigation of these complaints, 9 out of 10 of our clients who say they never got the packet in the mail either had the wrong address on file with TennCare or they admitted to throwing it away. So it's very important that we understand Social Security does not update addresses with TennCare or any other state organization. Social Security only communicates with Medicare. or CMS, the Centers for Medicare and Medicaid Services. So if a beneficiary recently moved and they changed their address with Social Security and that was it, and now they're eligible for redetermination, 9 times out of 10, TennCare is going to send that packet to the old address, and the beneficiary is never going to know that they're eligible for redetermination. The best thing to do to help your beneficiary make sure that their address is correct is to complete the change of address form and fax it into TennCare to make sure that they received it. Nancy, you have a question.
Yes. Do you know if those packets are marked forwarding, or sometimes it'll say on it, do not forward? You know, if they put a change of address in the post office, it should get to them. But I'm also thinking from TennCare status, I can see why they'd say do not forward, so people will call in with their changes of address.
I have not seen the actual envelope that the packet sent in, so I'm not sure if that's on there. Has anyone seen the envelope from a client who they've worked with and remember by chance if they have a do not forward on there? I'll look into that, Nancy, and I will ask our contacts if they can send me a copy of what the envelope looks like.
Yeah, I was just curious, and I'm thinking when I'm enrolling somebody or doing it for somebody, if I'm helping, I'm going to tell them, make sure, which I mean they should know, any address changes you need to get directly to TennCare. That's
right.
the bottom line.
I don't think it have do not forward on there. I'm not sure, but I don't think it had it because we had one like lived in one side of the building. They moved to another side, and they didn't get their address, their packages. But I don't think it's on there, though.
All right. And coming from someone who recently moved and I had my mail forwarded, it didn't necessarily come as quickly as if someone had my correct address. So It's also possible for that as well. Carolyn, you have a question.
Do we use the same fax number that we use for the form itself and documentation? We use that 1-877-430-0843 number to fax an address change?
No, you want to fax that address change to the same fax number that you fax the Medicare Savings Program application.
And that is, I haven't done one of these in quite a while.
I don't have that fax number right in front of me. If anyone has a copy of the Medicare Savings Program application relatively handy, can you tell me what that?
The application form. Okay.
We have one right here.
Okay,
the fax
go for
number is 855-315-0669.
Thank you.
Yes, thank you. I believe that was Kelsey, right?
That was me. Thanks.
Thank you, Kelsey. I much appreciated it.
You're welcome.
Good to know
Emma.
Go ahead, Emma.
If you're calling in, there are 2 steps to it. The first person will verify the address of them before you even get to speak to a representative, and they'll do all the changing, and then they'll mail out you the new one to that address.
Excellent. So, and you're talking about calling the renewal packet number, is that right, Emma?
Yes, ma'am. To call them the renewal package and tell them, I'm trying to think of this word. I'm lost for words. Okay.
Just to verify the address?
No, it starts with, you want to do, and it starts with an A, and I'm always forgetting this word.
Authentication? Authenticate?
No, not authenticate. Not amendment, but it's something like you got a problem going on, and I can't. Okay. It's on the package information anyway. The word I'm trying to think of when you call in to get another.
Hey, is it affidavit?
Affidavits. Thank you. That's the word I was trying to think of.
Awesome. So definitely when you call that packet, call that number, they'll confirm your address and then send you a packet to the correct address. if you want to be overly cautious, like I am on everything that I do, I would change the address with the person on the 844 number for the renewal packet, and I would also send a change of address just to make sure both avenues have been exhausted. Oh. Okay, if you help them change the address for these, oh, I lost it. Somebody said something in the chat that I feel is important. Okay, if you help them change the address for an individual, it's a call back a few days later to check. Okay, great. Thank you, Carol.
Right. And Sydney,
yes.
I have my hand up here. So I guess at the bottom of this slide, with two things. Ever since they took it away from DHS, most people really have no idea other than with Social Security how they're on this SLMB, QMB, they don't know. So if they change their address, where is you got completed the TennCare change of address form? Where is that form? Is that on another side?
No, I sent it in the attachments for the materials.
Okay.
And I can also, let's take a quick peek at it. Maybe there's a different number. So here, yes. Oh, look, there's the number for whoever asked the number. My fault. But thank you, Kelsey, again, for being on top of things. So here's what the change of address form looks like. And there's the number that you're going to fax it to.
Because they wouldn't know that. Most of these clients would not know that.
Well, sure. And then that's another common trend that we're going to talk about here in a minute. Oh, rats, I did the wrong thing. Sorry, guys. Let me get to where I'm supposed to go. All right, so that's your common complaints on that. So the next one that we hear a lot of is my client got a letter from Social Security saying their premiums are going to be deducted from their check and money is cut in half. So sadly, most of our beneficiaries don't realize that anything's going wrong until they get a letter from Social Security saying that $300 and some odd are going to be deducted from their check. And this kind of goes back, majority of the time, goes back to TennCare having the wrong address. Because if you're getting notification from Social Security, but you haven't gotten the packet from TennCare, there's where your miscommunication on the address is happening. So again, I guess I just really want to stress the importance of making sure all of our beneficiaries have the correct address on file. And that's something I know I'm going to be adding to my outreach presentations and adding information about that to all the booths that I attend, is really making sure, especially when you're talking to beneficiaries or family members of beneficiaries. Maybe you have sons or daughters or nieces or nephews or grandkids who are attending these events to help make sure that they know how to help mom or dad with their benefits. Telling them about making sure the address is correct at TennCare is extremely important. One of the biggest complaints that we get from our clients is the packet is too complicated and then the client threw it away. They don't want to deal with it. I know that I have many, many clients. Some still think changes with DHS is enough. We're going to talk about that as well, that it is not enough to just change everything with Department of Human Services. You have to change it with TennCare as well. And I believe that is, yes, that's my next trend that we're going to talk about. How many of you have clients who don't open their explanation of benefits for their drug plans? Or don't open their Medicare summary notices?
90% of us.
Exactly.
Or don't read their Medicare book.
Don't read their Medicare book, don't open anything, and that causes a lot of issues. So it's the same thing, even though they get a big packet and it's super intimidating, and I know I would be intimidated if a 98-page packet from TennCare came to me. I would be super anxious and probably read the first couple pages and say, I don't want to do this, or put it off to the side and then never look at it again. Again, it's really important for us to stress during our outreach how important it is that, yes, it's a big packet. You only have to fill out half of it because only half of it is in the language that's your primary language. and just make people aware that it's coming. It may not has not come to them yet, but it eventually will. I know all my clients that tell me, or I do an application for Medicare Savings Program, and they call me back and say, hey, I was accepted. I said, wonderful, I'm so happy. And even though you were just accepted, in maybe a year or so, you're going to get a really big packet to renew your benefits. Now, I don't know if it's going to be in a year or it's going to be in 2 years, but I know it's not going to be next month if they just qualified for the program. So I would give it about a year that, big packet's coming. Or if I'm just talking to somebody, especially during open enrollment that's coming up, and they say, yeah, I qualify for QMB. Oh, well, have you gotten a big packet in the mail from TennCare yet? Well, no. I said, well, it's going to be coming. We don't know when it's coming. It's kind of like Jaws, do-do-do-do, and, as soon as it's coming, the music's getting faster. But it's something to look for and make sure that they're aware. If something like that happens and it comes to you, feel free to give us a call and we'll help you with the packet. And throwing the application away is not a reason for TennCare to reinstate your benefits or for you to win an appeal with TennCare. Because you threw it away, it's not TennCare's fault. And I had a comment that I was not able to see, or I had a hand raised, or some flash came on the screen that I didn't see.
I'm on. Carolyn's on. Can you hear me?
Yep, I can hear you, Carolyn.
A couple of questions. Number one, is there any kind of schedule for renewal for people coming on to MSP or SLMB? Will we have a way of telling them when they can expect the renewal packet if they're just coming on? Will
no,
it be
we
a
have
yearly thing, a biannual thing? How will they do this?
We haven't been told how they will do renewals and redeterminations after they've redetermined everyone who's currently on the program. So we haven't been given any information on that.
And I have a second question. Will SHIP be sending out notices to people in our areas that we normally work with on Medicare, like when they send out the form to list their drugs? Will some sort of notice go out that we can help them with these renewal packets?
I'm planning on putting together a flyer and some information to go out in the packets that the commission sends out to our previous people that we've helped with Part B. And I will share that information with our staff and strongly encourage them to include that in their mailings as well, to have some information about renewal packets, the importance of changing that address and making sure the correct address is on file with TennCare, just to kind of get the word out to people who we're already helping. Even if, and not all of my beneficiaries that I help qualify for a Medicare Savings Program, but you never know. Those people may have parents that qualify for it. Or it may not apply to them, but it'll apply to a neighbor. So definitely, I agree 100%, Carolyn, that we will have something like that in our mailings that go out for open enrollment, for sure.
Okay, thank you.
Thank you. Great question and comments. Excellent.
Hello. Hey, Sydney, this is Barbara again.
Barbara, yes.
Okay, years ago, I had a sister who was on TennCare, and every month, TennCare mailed them a card. Do they still do that? Or are you saying that these people have not received a card since January of 2014?
It depends on what benefits you have. So the QMB card, for example, the pink QMB card, if you qualify to get a card, those are now sent out on a quarterly basis. So you'll get one for January to March, April to June, July to October, and October to December. And those cards should come in an envelope that says TennCare on it. So if we do have beneficiaries that are getting QMB cards and they say, I didn't know I was on TennCare, the envelope should, and especially the pink QMB card, has the word TennCare on it. So I don't think those are the people who don't know that they're on TennCare. Also, people who are getting TennCare from a managed care organization like Blue Cross Blue Shield, Amerigroup, or United Healthcare, they have a card. I think that card is issued on an annual basis. I don't think that it's quarterly, or definitely, I know it's not monthly, but I'm pretty sure it's an annual basis, to let them know that they have TennCare benefits. But the ones that I think we're seeing these trends with the most are our SLMB beneficiaries and our QI1 beneficiaries, because they don't get any card. They don't get quarterly notification that you qualify for this program. They get their initial, you've been accepted into the program from TennCare, and then they just keep their benefits. So they don't get any kind of update necessarily that they have those benefits from TennCare like the QMB and the regular TennCare people do. Did that answer your question, Barbara?
Yes, it did. And one more, you said that if they don't send the packets back, the money is going to be deducted from their Social Security. Well, going back to my sister, she had SSI and Social Security. She wasn't, and Medicaid. So she wasn't 62, so she had the Medicaid TennCare type thing. So this money has been deducted from the disability portion of your check or the Social Security portion of your check?
That depends. Now, I was waiting for someone to bring up SSI. I was waiting for it. So if you qualify for SSI, you automatically get Medicaid. And SSI is actually redetermined by Social Security. SSI recipients are not redetermined by TennCare, is my understanding, because SSI is a Social Security program. So they may be redetermined on a different time frame than our Medicare Savings Program beneficiaries. So if their premiums are being deducted and they have SSI, and I'm going to look into this more and get you some concrete information, my gut would tell me that the premiums are going to be deducted from the SSI check, because that's the reason why their premiums are being paid for. But I am going to send that question in as well to my contact to get some more clarity on that. I don't mean to be quiet, but I'm writing notes. Excellent. Any other questions? All righty. Last but not least is the one that many of us have already been talking about. I don't have TennCare, so I threw the packet away. Or I didn't even fill it out because I don't have TennCare. I don't know what TennCare is. I've been told I don't qualify for TennCare, and I never will qualify for TennCare. So like we've been talking about, some of our beneficiaries, and I think it is more of our SLMB and QI1 beneficiaries who don't realize that TennCare has taken over. Because maybe they qualified for SLMB back in 2009, and their acceptance letter came from the Department of Human Services. And TennCare hasn't sent them anything that says, hey, you're with us now. Or if they did, it was back in 2014, and that letter could have been filed away. So it is important, and it's very confusing for our clients, but it is important for us to let them know, again, while we're doing outreach and things like that. But in the same article that I referenced earlier that came out of the Knoxville area, TennCare is quoted in that article saying, we have made recent updates to the envelopes MSP recipients are sent to include language about Medicare benefits. So that's another reason why I'm going to request a copy of the envelope so we can see exactly what that wording is. So they are trying, they've heard this complaint and this trend with the beneficiaries, so they are working to get some different language on those envelopes so people who are on TennCare do some Medicare Savings Program, they may open, that's going to give them more of a reason to open up that packet and read it. And again, I don't know what the wording says right now, but I am going to request that, and I will send it out to everyone once we get that. All right, any trends that I have missed that we want to discuss, or any other kind of open discussion? That's all I have in presentation-wise, and we have about 12 minutes left on the webinar. So I think, Carolyn, your hand was raised before Alice.
Okay, I have another question about I've had a number of clients, and I am still confused about TennCare versus Medicaid in the state of Tennessee. It's just very unfamiliar to me, having come from a state that it was just plain Medicaid, you know. But anyway, so I've had a number of clients whom were put into managed care plans with very little education to them about what was happening. And then they have come in to see me and said, well, I'm having trouble because I can't get my transportation to the doctor under this plan, and I have to go to the doctor every other week in Cookville. So we've been moving them back into regular Medicaid by opening a Part D drug plan for them and getting them off that managed care plan. Now, is there a change there because of TennCare? Are they going to have to reapply or do anything like that in order to get off that managed care plan?
Well, I think you're confusing the Medicaid managed care plans with the Medicare Advantage plans. Because the managed care through Medicaid are only through Blue Cross Blue Shield, Amerigroup, and United Healthcare.
Right.
So that's going to be
the plans I'm talking about.
Okay. So I don't know.
Transportation, and if somebody is on Medicaid, or in the past, if it's been Medicaid, then they get their transportation. But if they're on one of those managed plans through Blue Cross or Ameri, whatever it is, Blue Cross has been the problem one. Then they don't get transportation costs. Or they have, so many trips allocated for the month when they need double that. I guess that's been the real problem.
Well, that's a different TennCare policy than what we're talking about now. And I'm not sure exactly what that policy is.
But my question is, because of the change for MSP and SLMB, et cetera, because of the change from Medicaid to TennCare, is that going to create problems with the managed care?
It should not. The only change that can happen with the managed care is if the beneficiary requests a different managed care organization during kind of like their open enrollment where they can switch providers. Now, if you only qualify for QMB, SLMB, and QI1, you do not qualify for transportation services. So you do have to have that managed care organization, the Blue Cross, the United Healthcare, or the Amerigroup, to get that transportation benefit. QMB, SLMB, and QI1 do not provide transportation services. So I don't think that I answered your question. I'm
probably still just confused about this anyway. And
yeah,
maybe
that's
it wasn't my QMB people that it was a problem for. Maybe it was others.
It was probably others, unless they get SSI and they get Medicare or Medicaid through the SSI program.
Yeah. Well, we've had some of those.
So that's something definitely, Carolyn, you and I can talk about that individually, and I can work getting some questions to ask my contacts about that for you.
Okay, good. Thank you.
You're welcome.
This is Nancy. I've just got some basic comments on this.
Okay.
I think one thing that is confusing to everybody when we say TennCare, that's this big old ball of stuff. And although QMB, SLMB, and QI1, the Medicare Savings Programs, are administered through TennCare, that does not give those beneficiaries full TennCare benefits. They do not have the TennCare managed care organizations. Someone can be on one of these programs and actually not have TennCare. It's the administration of the program that is going through TennCare. And unless someone has full TennCare benefits, they are not eligible for the transportation, be they on original Medicare, Medicare Advantage plans. If they aren't dual eligible, they're not going to have the transportation benefits. And I think where a lot of the confusion comes in, MSPs are administered by TennCare, but that does not give them the TennCare benefits, which the transportation falls into the TennCare benefits. And I think that's where, from my standpoint at least, where a lot of the confusion comes in. Does that make sense?
It does. Thank you, Nancy.
This is Judy Codwell, and I'm sort of like the other lady. I am confused. Is there going to be another class that we can attend to, like, maybe I missed a piece somewhere? I understand what's going on, but I don't know. I don't know if I can explain it to anybody.
Judy, what region of the state are you in?
I'm in Memphis. I'm sorry.
That's okay. I will talk to the coordinator in Memphis. I know they're doing an update training before open enrollment. So I'll ask and see if we can cover some of the renewal packet in the update training if you're able to attend that. I believe it's in early September. I don't remember the date off the top of my head. Alice or Laura, you may be able to help me with that.
I don't remember the date, but it is in September.
Okay,
And
I'll get with Alice. I'll get with Alice.
Right.
Okay, sounds good.
All right, so did I get my question in now, didn't
Yes, go ahead, Alice.
All right. So yesterday when we walked through with the client, when we called the 844 number, she had gone around in circles. Everybody was giving her numbers, okay? So when she called our number and they gave her the 844 number, she called in. So she was trying to see where her mom was. Her thing was her 90 days was going to be up July 24th. So we got on the line and started the process over. When we called the 844 number, she looked it up. She said, yeah, you're going to be up July 24th. You won't be eligible for anything. And so she said, where do I call? She said, call the marketplace. And I was like, what marketplace? And the number she gave us was basically, she said, because she's off all of her insurance, she's no longer eligible, call the marketplace to get reinstated. So we got off the phone with her. The lady said, I called that number. They told me they couldn't help. So I had our choices folks to look her up in Tennessee anytime, and they did. They had opened her up on the 17th of July, closed her on the 19th of July, and we ended up calling the 855 number. So my question would be, shouldn't the customer rep at the 844 number should have been able to tell? This lady was not on a managed care plan. She was not in Amerigroup Blue Choice. She had a Cigna Health plan and she had SLMB. What did the lady at 844 not know because that's the third person that I've heard that they told to call the marketplace.
I don't know why they would say to call the marketplace. And I don't want you to tell me this on the webinar, but
I'm so sorry.
That's okay. But if you have the agent who you talk to at the 844 number, please email me that person's name.
Okay.
And that's true for everybody. If you call, it could be Tennessee Health Connection, it could be the TennCare Renewal Packet line, it could be Social Security with the Part B, limited-time only, equitable relief. Get the name of the person that's answering the phone. That way, if they give you misinformation, like call the marketplace, we can send that into our contacts who are kind of higher up the chain and make sure that they know what their representatives are saying, and they can do the education to make sure that it's not being said anymore. And if something happens that's said and it results in a penalty or something along those lines, we have the person's name that they can look up to see what the conversation said and see if there was any repercussions based on that conversation. So, again, don't tell me the name of the person now, but shoot me an email if you have it.
Yeah, it's on the client contact we did at the office, so I'll get it. Send it to you.
Yeah, perfect. Send that to me, and I will send it into our contact to see what's going on there and let them know that that's a trend that's starting.
Right. Thank you.
No problem. Anything else? Any other trends or any other discussion that we want to talk about? We have about 2 minutes left in the webinar.
So let me that last little thing. Oh, I'll take my hand down, but I do have another one.
Okay.
What I think somebody said earlier that about the 90 days, because I think we were kind of defaulting to, if it was past the 90-day period, let's just do a new packet. And I love that comment that you made. That could just start them over and disqualify them for their possible retroactive if they're approved. I think we really need to hone in on that because we've been doing quite a bit, or the office has been doing quite a bit of, well, let's just send out a new packet without, I think we were unaware of the potential consequences of that. Because when we did talk to the 855 number yesterday, he did say, yeah, I see you've made the request through the redetermination department to send a new packet. As soon as she gets it, that letter, even though hers was a week away, he said that letter will give her the new date, and she needs to get it in as soon as possible. So we shouldn't take the 90 days as an automatic, okay, let's just send in a new packet.
Exactly.
You know what I'm saying?
So, yeah, definitely check with your SHIP coordinator to see when the benefits were terminated. Like I had the April 17th person. They had 90 days. That was this week. Technically, if you think about the whole 90 days, that would have been July 17th. I still told the coordinator, have them call the renewal packet to see if there's any chance that they could get a new renewal packet sent out and see if they can get those benefits retroactive. So even if it's a few days past the deadline, the best thing we can do to make sure that those benefits are retroactive is to call and see if they can get that deadline extended. The worst thing that they could say is no. The best thing they could do is say, oh, okay, you know, you're just a couple days past and here's the new packet and the new deadline. So always, I err on the side of trying to get our beneficiaries an extension rather than doing a whole new application. All right. So we did have one comment from Carol that said, once they get the Medicare letter about termination, I think from Social Security, they can call right away and get a renewal packet and ask for an appeal while they are waiting. It seems to help them get extra time. I agree with Carol 100% that once they get that letter from Social Security about premiums being deducted, and if they call us, have them call the 844 number to see if they can do an appeal to get some more time.
When we called the 844 for appeal, she transferred us to the 855 number, who transferred us to the appeals department. It could have been just us, but that's what happened.
And it could be that what I would do is I would call the 844 number, see if they're able to grant the extension. If they're not able to, you may have to contact and get transferred over to the appeals department to get that extension. I'm not sure which department does that. All righty, well, we are out of time on the webinar, so I do ask that if you came on the webinar late or if I didn't call your name at the beginning of roll call, that you shoot me an email and let me know that you were on the webinar. That way you can get 1.5 hours of update hour credit, and I can send that over to your coordinators. And for those coordinators who have, or volunteers who have groups of people with you, you could do me a favor and just make sure I have everybody's name by shooting me a quick email with everybody who's with you. So thank you all so much again. I'm going to stop the recording, and it will be posted on our YouTube channel soon, and I will send the link out to everyone.